the union is a way, as you're saying, to have the needs of units heard. So what does the neonatal intensive care unit need?
We need more staff. We will have times where we have our charge nurses who are responsible for overseeing the entire unit, taking a patient assignment. We have, when babies are really sick, we have nurses, just one nurse to one baby. Well, there's times where it should be one nurse to one baby and it's stretched to one nurse to two babies. It leaves room when you're short-staffed for errors, for bed sores, for longer hospital stays, and also when we're so short-staffed and we're stretched so thin, we cannot provide the education for patients that they deserve and that they need.
So talk a little bit, what would that look like? What does that mean when you're saying the education for patients that they need?
So when we are getting ready to discharge a patient home, if they have a new diagnosis or something complicated to go home with, they need to know where their status is, what they need to do. If it's a new diabetic, that is a huge learning curve, and they need a lot of time spent with them with education. And when we're short-staffed and you've got critically ill patients, your time priorities in terms of triaging what's most important, it's going to take away from the new diabetic who needs all that teaching because there's someone who can't breathe. So it's not fair to the patients, it's not fair to the community. They deserve our best every day, and nurses are in tears because they can't provide their best every day because we're so understaffed